Well, thank you so much for the opportunity to come and join your group for the night and speak to you about the health impacts of gas. And I loved the title that Steve suggested: Doctor's Orders, Get Off Gas. And of course, this gives the whole issue of getting off gas a whole nother angle, perspective, something that can be more nonpartisan, perhaps, when we do our advocacy. So hopefully, I can impart a few things that can be of use to the group, and then we'll talk about some of the advocacy that CAPE and OCEC have been doing. So we'll just start with a really brief introduction, and then I'll talk about health impacts, both of climate change and air pollution, both of which arise from burning gas, and then a little bit about advocacy and any discussion. So in terms of introducing CAPE, Canadian Association of Physicians for the Environment, we've been around since 1993, physician-directed nonprofit, and we work to secure human health by protecting the planet. So we have a national arm and we have regional committees all across Canada. And my affiliation is with the Ontario Regional Committee. And we work at sort of the intersection of health and environment. Some of our activities include things like engaging with government and our policymakers, running campaigns, and doing education, research, and media as well. And a little bit about the OCEC that some of you may not be familiar with. This is a nonpartisan environmental democracy campaign or movement. And the idea is to promote awareness on environmental issues and urge political leaders towards climate action and climate policy change through the power of democracy. And our structure is a multi-sector coalition, which is open to all individuals, but also now includes over 270 organizations that collectively represent around 850,000 Ontarians. And everyone who has signed on, individuals and groups, have signed on to an evidence-based 12-point climate action plan, and we work collaboratively to make that happen. So getting back to the idea of the intersection of health and environment, I'd like to start with this quote from the WHO that a healthy planet and healthy people are really two sides of the same coin, and we just can't have one without the other. So similarly, if we think about the human health harms that arise from burning gas, other fossil fuels, again, there's sort of two sides to the coin, two pathways that lead to harm, one being carbon pollution that generates greenhouse gases and climate change, the other being air pollution that generates particulate matter and toxic gases, especially nitrogen oxides. And we'll talk about indoor versus outdoor pollution. So if we look at the entire envelope of health impacts of gas use, first of all, if we look at our in-home gas appliances, our furnaces, stoves, water heaters, and so on, these can contribute both to indoor and outdoor air pollution, as well as, of course, climate change. Whereas fossil gas in our energy grid, so for example, our gas plants, contribute to outdoor air pollution and climate change. But whether we are burning gas, whether it's leaking anywhere in the supply chain, or even unburnt gas that is released directly as methane from our gas stoves right into our kitchens, all of these increase the risks of illness and death by various mechanisms that we'll look at in the next few minutes. So if we start with the health impacts of indoor gas, gas stoves, there's been a lot of recent research, significantly increase the risk of childhood asthma by as much as 42%. There are some US studies suggesting that up to 12% of all childhood asthma may be attributed to gas stoves. And it is as harmful, we understand now, as secondhand smoke. Our stoves also release several harmful chemicals that are linked to health issues ranging from lung diseases to cancer. So things such as carbon monoxide, nitrogen dioxide, formaldehyde, benzene, which is carcinogen, and some of these leak even when our stoves are switched off. Meanwhile, gas furnaces release pollutants directly into our backyards. And when we put this all together, we find that buildings contribute about 1/5 of all NO2 that is found in air pollution, mainly because of gas use, and about 1/4 of all greenhouse gases in Ontario. And in fact, buildings rank second only to transportation, sort of as the biggest sectors that contribute our greenhouse gases. So if we look at the two pathways to harm that we talked about earlier, and we think of climate change first, this is now recognized as the single greatest health crisis of our time, where our very survival is at stake. And this Canadian Medical Association poster sort of highlights the various impacts right across our country. And this ranges from things such as the impacts of extreme heat, which can physically range from things as simple as heat rash to stroke, body swelling, acute heart disease, and so on. And in fact, the single deadliest weather-related incident in Canadian history, in fact, it was a heat event, and it was the heat dome in BC in 2021 that killed over 800 people. And of course, there are other impacts on health, such as through crop failures and so on. And where we have heat, we also have fire, unfortunately. We are seeing increasingly severe wildfires, which create multiple health risks of their own. We could do a whole talk just on that, and further escalate carbon emissions. So they really add to that spiral of spiraling emissions, causing even more emissions. And the climate crisis harms both food and housing security, both of which in turn are social determinants of health. At the same time, climate change is aggravating nearly 60% of all infectious human diseases, as you see in this map. And you can see, some of these dots are squarely falling in North America as well. And at the same time, it is increasing antibiotic resistance. And that sort of double whammy is a real concern to the medical community. And we have as well devastating mental health impacts from climate change, and these fall disproportionately on our youth, which makes it, all the more devastating. And there is a higher incidence of depression, addictions, suicide. A recent massive global study of 10,000 youth showed very high levels of climate anxiety, hesitancy to have children, and that the majority of youth around the world feel that governments are betraying them and future generations. So if we turn now to the impacts of air pollution, first of all, just a quick primer on sort of the most important constituents of air pollution, especially when it comes to our health. There are many other components, but the WHO lays out 4 key components, which include particulate matter, ozone, which is ground level ozone, not the ozone we're used to thinking about in the upper atmosphere, nitrogen dioxide, and sulfur dioxide. And just a quick note on the air quality index, which some people are becoming increasingly aware of and paying attention to. We report our AQI a little bit differently from the US. For instance, we have a simpler sort of 1 to 10 scale, with low risk days being sort of 1, 2, 3 ratings, and 7 and higher being high risk days. And the index is generated through a standardized formula that takes into consideration particulate matter, ozone, and NO2 levels on that particular day. And just an example of how we can use this in our lives. This is just an example of a moderate risk day that I picked out from a random day last summer. And there are recommendations made that on a moderate risk day, at-risk populations might consider modifying their outdoor activities, whereas for the general population, generally we can carry on as usual. And we'll talk about, who is in that at-risk population. If we look first, though, at the context, how big is the problem of air pollution? It turns out it's really big. Globally, nearly 7 million people die prematurely every year because of breathing polluted air. And this translates to over 15,000 Canadians every year and nearly 7,000 Ontarians every year. And these figures for Canada are a little bit outdated, even we're really in need of new statistics. And if we look at it in another way, across the planet, about 1 in 5 premature deaths is due to breathing polluted air. So how do these impacts happen? Let's take a quick look at the impacts of air pollution on a system-by-system basis in our bodies. I wanted to start just by highlighting a really excellent report that was actually published by CAPE in 2022 regarding traffic-related air pollution in particular, and it's open access. I've provided the link here. And this was a synthesis of nearly 1,200 scientific articles from around the world, brought together, collated, and in order to generate recommendations based on the evidence, and summarize health impacts, epidemiology, equity, and so on. So a really good resource that people can access. But when we breathe in polluted air, especially the particulate matter and nitrogen oxides and dioxides gases, these enter, of course, through our lungs, but unfortunately are able to cross beyond the lung and into our bloodstreams, where they distribute through the entire body, and thus the ability to cause multi-system disease. So, of course, we anticipate lung disease, so things like asthma, COPD, pneumonia, and so on. But there's also high risks of heart diseases, so things like heart attacks are higher on some of these high-risk days, irregular heartbeats, high blood pressure. This is an example of new research showing that young, healthy teenagers exposed to within about 2 hours of being exposed to breathing polluted air actually begin to demonstrate heart irregularities. There's also risks of neurologic or brain disease, so things like stroke, dementia, ADHD, and so on. And again, very high-level research, so meta-analysis level research showing that, for instance, even a small increase in pollution levels can raise the risk of dementia. So we have a lot of evidence. Breathing polluted air is also an endocrine disruptor. So we can see diabetes, obesity, and these are not just bystander effects from being inactive. These are because the pollutants are actually disrupting our endocrine systems. Air pollution is also directly linked to multiple cancers, and the strongest links are with lung, leukemia, and breast, but there are others. And it poses serious health risks to pregnant women and babies, including low birth weight, prematurity, stillbirths, and birth defects. It has also been shown to increase multiple risks associated with COVID-19, ranging from infection risk to transmission and the risk of death. Finally, well, not finally, actually, penultimately, air pollution is also linked with rising antibiotic resistance, so independent of climate change. And in fact, within the next few decades, projections are that we might be seeing, 840,000 extra premature deaths every year simply due to this phenomenon. And finally, air pollution also is an independent risk factor for mental health impacts, ranging from anxiety, depression, stress, suicide, and so on. And again, I've shown here that this is very high level evidence at the meta-analysis and systematic review levels. And there's also a huge equity issue built into all of these concerns. Today, about 99% of the world actually breathes polluted air, according to WHO standards. Of course, here in Canada, we are relatively lucky with having wonderful air quality. But for instance, with the wildfires last summer, there were several days during which some of the worst air quality on the planet was measured right here in Canada. But when we look at equity, for example, the over 4 million premature deaths that happen due to outdoor air pollution every year across the world, 91% of these are occurring in low and middle income countries. But right here in Canada, there are equity issues as well. So it is proven with Canadian research that lower socioeconomic status is linked to higher air pollution exposure, higher health risks, and greater barriers to healthcare access. American literature shows similar trends for racialized communities, but that work hasn't been done formally in Canada yet. We also know that increased levels of traffic-related air pollution typically occur within about half a kilometer of major roads. And in fact, 1 in 3 Canadians live within even half this distance, within a quarter of a kilometer of such roads. So a lot of us are being exposed. So that gives us a little idea of some of the, the multiple health impacts that we can anticipate and project due to burning fossil fuels such as gas. So let's turn now to look at how we can use that, or how CAPE and OCEC have been using that to advocate to oppose gas across Ontario in the last little while. I probably don't need to go through this backgrounder for this particular group, but just to reiterate that, of course, we enjoy a largely decarbonized grid today in Ontario, especially thanks to the coal phase out that was completed in 2014. But much of our energy mix now consists of aging nuclear infrastructure, which is very expensive and very slow to either refurbish or build new capacity. So, of course, the government of Ontario had proposed expansion of methane gas-fired electricity to meet these demands. And of course, we want to also factor in the issue of creating massive stranded assets, whether we're looking at the OEB decision or the gas plants that we had been sort of fighting all through last year, when the CER hopefully comes into effect. So I sat down and tried to sort of look at some of the different factors, or some of the different avenues through which our advocacy has sort of happened when it comes to gas advocacy in Ontario. And some of the different ways in which we've advocated include public education and engagement. Through CAPE, we did a health sector open letter that we'll talk about. We've done media, and then of course we have been engaging with policymakers, whether it's deputations, lobbying, and so on. So I thought I'd sort of present things in a little bit of a timeline. So at the level of OCEC, we actually designed and launched a formal campaign called the Beyond Gas Campaign. A few of us at OCEC actually completed a one-year climate health organizing fellowship that was offered through Harvard. And one of the requirements was to have a real life on the ground project where we could actually apply the principles we learned. So we sort of put that into the Beyond Gas campaign. And of course, we have multiple partners. For instance, Environmental Defense has been running their No More Gas Plants campaign. And of course, many, many other allies. There has been an informal sort of gas allies group that has formed. And some of you may be joining those meetings already, and everybody is welcome to join, and they are ongoing. And they happen every couple of weeks. We save time in our OCEC meeting agendas, and once a month ED is convening those meetings now as well. So to officially launch the Beyond Gas campaign, we actually organized a pair of public offerings. So the first was an advocacy workshop where we partnered with Citizens Climate Lobby. And the idea was to engage the public to become comfortable with engaging their elected officials. So they were taught lobbying skills, the value of calls, letters, emails, and so on. We then followed up with an informational session where we were lucky enough to get Mark Jacobson, who is really a world-renowned expert from Stanford on renewable energy systems. And he did a great webinar. And we had hundreds of registrants, and we really tried to sort of build the awareness and give people the knowledge to go ahead and start advocating. On the CAPE end, we followed that up with media. So we were lucky enough, the Hill Times was having a special edition focused on methane. And I wrote a piece along with Rob Barnes, CAPE's National Climate Program Director. And we were able to, as I've sort of highlighted in the very first paragraph, make the direct link between methane gas and public health harms, in addition to the usual angle of environmental harm. Soon after that, CAPE also did an open letter, and on the right you can see a little excerpt from that. It was directed to Premier Ford, And we basically said that as a group of health professionals from across Ontario, that we were demanding an immediate moratorium on gas expansion. We got nearly 400 signatures from Ontario health professionals and distributed it to the list that you see in the letter excerpt. And interestingly, so we CC'd the federal government as well. And on the same day we released the letter, I actually received a message from Stephen Guilbeault's staffer, who is the official liaison between Environment and Climate Change Canada and the province of Ontario. And he requested to meet with us, and we were able to get a couple of meetings in with him. The letter was also picked up and used in multiple municipal gas deputations over the months to come. In September, we also had a very busy time. We did a number of actions all around gas. So we did another very large scale public webinar with hundreds of registrants. We again were lucky to get a very well-known expert, Ralph Torrey, come in and speak to us and sort of give a critique of Ontario's energy plan at the time and a pragmatic, vision for renewable energy future. And one of the reasons we kept sort of going back to renewable energy as well is we really wanted to run this campaign as a positive campaign, sort of extolling the virtues of renewable as opposed to constantly simply opposing gas. This was followed by the Global March to End Fossil Fuels, and at the Toronto March at Queen's Park, both CAPE and OCEC were quite involved. And again, CAPE was advocating on planetary health grounds. We tabled, we marched, etc. And podium speaker time was given to CAPE, so there was a chance to really get that clear messaging out. And as you can see in the picture with the OCEC banner, that present, along with the thousands of people present, there were elected officials even from federal levels as well as provincial and municipal. And at the march, this is one of my favorite pictures with all the med students. So we encourage all healthcare professionals to show up in scrubs, to identify themselves to the public as being involved, supporting the cause, and connecting it again directly as a public health issue. So this is some of the CAPE crowd with all the U of T med students, our coordinator. We all have our handmade signs, and we were just getting ready to join the march. And then on the right-hand side, you can see the march itself and the thousands of people in the streets. And at the very front, we've got our Beyond Gas banner from OCEC. And in fact, I just slipped this in at the last moment. I was trying to double check, if we had a head count for how many people that showed up at the march, and realized I hadn't seen this National Observer piece before, but they happened to use as a photo, again, the OCEC banner. And the very first quote that they have was from myself speaking for CAPE. So we were able to get some good media as well, some of it which we didn't realize. Now there we go. Also in September, we did a lobby day right at Queen's Park. So this was done in the dining room at Queen's Park. We had a few lobby partners along with CAPE and OCEC. This was put together with CCL, Citizens Climate Lobby, doing trainings for us and being an amazing sort of a convener. We had a couple of keynotes. So again, I spoke on behalf of CAPE with one keynote, and my co-speaker was Zoe, one of the youth plaintiffs in the 7 youth plaintiffs who had litigated against the province of Ontario. And our central ask at that time was to promote renewable energy across Ontario while opposing gas expansion. Meanwhile, CAPE also has done a number of meetings with various MPPs, councillors, and so on. We formed a subgroup within CAPE dedicated to gas advocacy. We've been collating the recent research and evidence base so we can use it in different ways. One of our CAPE members is a constituent of Marit Stiles, so we were able to get a meeting with her as well, which was great. And then we've also been doing more media. So this is something that the Toronto Star picked up in November, where I'd written about, again, just framing gas as a failure in public health. And then this piece was sort of picked up by a real Toronto Star reporter, so Mark Ochone, OVED sort of cited it in some of the media that he was doing, and it was used by multiple or distributed to multiple town councils who were voting on deputations for gas expansions. So that brings us to one of the keystones of the advocacy on gas that happened all throughout last year, really, which were municipal deputations occurring in jurisdictions where a gas expansion had been proposed. And typically, speaking at these deputations were sort of people representing expert organizations. So often CAPE was involved with most of them, but also the Atmospheric Fund, ED, OCAA, Clean Air Partnership, and so on. And then along with a small group of concerned citizens, who lived in those jurisdictions. And I put up that little cartoon there because by the end of the year, it really felt like playing a game of whack-a-mole. We had people watching the municipal agendas across Ontario because, of course, they were kept very quiet, and we typically had a week, maybe two at most, to get organized when something would suddenly crop up on the agendas and get organized and get in there and depute. I've tried to make here a list of some of the multiple municipalities where gas expansions were proposed and where votes took place. And the ones that are in bold print on the left are areas, or were areas where we were directly involved. Toronto and Brampton's votes had happened before we got involved. And I've tried to sort of summarize some of the outcomes of each vote. And one of the interesting phenomena that we saw is that as subsequent deputations happened, that the stakes became higher. And what I mean by that is that in the earlier deputations, the case for the gas plants was often being made by somebody just sent from the gas from the gas plant, from the oil and gas company. A slick presentation was made, and that was sort of it. But as we went through, the IESO actually got directly involved and we started to see Chuck Farmer, who is a vice president at IESO, showing up to depute himself, and they were no longer leaving it to the lower level employees. And also, in some of the last few deputations that occurred, we saw the offering of open fiscal incentives to town councils, trying to entice them to actually vote to approve the gas expansions, and the offer of money being strictly tied to an approval. And despite this, for instance, Halton Hills, which I'm just going to talk about very briefly, despite being one of the last one actually that we participated in and having the offer of money on the table, they still said no. And that was a really good model, we thought, of advocacy. This was a municipality where we began with deputation sort of in the standard fashion. We did a deputation mainly with the organizations deputing and just a few local people. But the town council in Halton Hills decided to pause for a couple of weeks before voting. And during that pause of a couple of weeks, we decided to get organized really fast, and we ran a town hall. And you can see on the right side sort of the promo that we got out. We invited people who lived in that area, the constituents. We also extended it to Loyalist Township because they had a vote coming around the same time. And this is just a shot from the night we ran the town hall. And we made it partially informational. So some of, again, organizations who were deputing presented sort of knowledge or, information, various angles on the issue of gas plant expansion. But then we deliberately saved time to equip people to understand how to best advocate within their own jurisdiction. So where to get lawn signs, where they could call, the value of sending a letter, an email, and especially we encourage people to sign up to depute and show up, at the next town meeting where the vote was going to be held. And incredibly, a number of constituents did sign up. So there were a number of local deputations the second time around, and one particularly eloquent youth deputation. And the result was that the council voted against the expansion. And that particular council took the time to tell us that initially, when they started the process, they were ready to approve that gas plant. And they took the time to tell us that it was specifically the campaign that we ran, the advocacy that we did, and hearing all those voices that changed their minds and changed their vote. So that was a really worthwhile moment. So in January, I'm almost done as we do the timeline here. But in January, of course, the current government of Ontario, we heard them for the very first time ever announcing renewable energy procurement bids through IESO, no matter how small. It was 5 megawatts, but that's a start. And we've not been made aware of any further gas expansion proposals since Halton Hills. But at the same time, we also heard in December the historic decision by the OEB to end ratepayer-funded Enbridge gas subsidies for new gas hookups. But the government of Ontario responded within hours, vowing to overturn that. And of course, more recently have come up with Bill 165 to do exactly that. So that brings us to the last little bit of advocacy that we've done. So what we did in response is in late February, we had already started to pre-plan our next Queen's Park Lobby Day in conjunction with CCL. And we decided to revise the ask a little bit. And we focused on supporting the OEB to oppose gas subsidies. And this time around, the lobby day was even bigger and better. As you can see, there's more logos at the bottom, so there were more lobby groups participating. And we actually had a much bigger turnout of MPPs, which was amazing, including even some Conservative MPPs. So it was wonderful to actually get a chance to sit down and talk to some. Keynotes were provided by TAF, Evan Wiseman, and Dr. Jane Pritchard, who is a community-based family doctor. And we had a bit of a busy week last week as well, relevant to what's going on with OEB and gas hookups. Right in my hometown of Mississauga, we've been working for a few years on green development standards, and this has been an incredible youth-led collaborative initiative led by New Majority in conjunction with David Suzuki Foundation. And the vote at committee was happening actually right during the eclipse. So a number of us deputed alongside New Majority at their invitation. And again, you can see that for my deputation, it was all about the public health benefits and tying it all in. And it was a unanimous vote to accept the GDS. There was, I think, one formality vote happening with the entire council actually today. I haven't heard about the outcome, but we were told that it was supposed to be a formality, and hopefully it is now finalized. And that brings us to last week's Stop Bill 165 webinar, where, of course, Hamilton 350, Lucia, your talk was amazing. So most of you may have already been on that talk or on that call, and we continue organizing against Bill 165 at this point. And of course, just to finish off, that in the spirit of sort of propose and not just to oppose, one of the things that we'd like to support is OCAA's current campaign to triple wind and solar in Ontario, in keeping with COP28 announcements this year, and hopefully more of this to come. So I'll finish with words that I used at the webinar last week. So some of you may have seen this, but a statement I love from the Canadian Public Health Association, reminding us that we are the last generation with the opportunity to avoid catastrophic climate change, which we must treat like the health emergency that it is. So thank you for your time, and I'll just hand it back to you for discussion.
Sure. Thanks so much, Mili. So since you brought us through the No More Gas plants campaign in great detail. I actually want to pivot and ask you about another campaign that CAPE has done, which is fossil fuel ads make us sick. And one of the things that I think, maybe people are already familiar with, but when we talk about gas stoves and gas stove use, this is not an accident. This is very much on purpose. It has been reported and shown that there was a concerted campaign started in the 1970s to get people onto cooking with gas. And that was, in fact, the phrase that they use that most people know, cooking with gas, right? The sort of messaging that was said again and again. And I looked earlier today at sort of the numbers from American housing surveys. I assume in Canada it's probably not all that different, that showed that from the 1970s up to the 1990s, rates of gas stoves in houses rose from 28% of residents reporting a gas stove in their house up to now more than 50% report a gas stove in their house. And that's the direct result of this advertising. We haven't seen levels of gas appliances in houses like this since the late 1930s as what we have today. And so a lot of that is related to this misleading advertising. And that was a campaign that CAPE has also focused on. I don't know if you want to discuss that a little bit more, and I can pop up an example of one of your ads while you're talking. But I thought that was really important to also talk about this misinformation that's being put out there, and to have trusted figures like healthcare providers helping to debunk that information. So yes, if you want to speak to that a little bit.
Sure. And the reason I didn't sort of include it in my talk is just so that you're aware, with CAPE, as I mentioned, there's sort of a national branch, and then there's the provincial. So my affiliation is provincial, so I can speak a little bit about it, but it's not work that I've been doing myself. But certainly it's been a really powerful campaign. I do know that when we were initially planning it, it was being modeled against some work that's been done in Europe as well. And that was, a little bit of the inspiration, for planning and sort of selecting this particular campaign. We, of course, have brought it to the attention of policymakers, and Charlie Angus was willing to bring this forward. And we're hoping that, that it's going to sort of continue to, to grow. But so far the uptake, has been good. And it has been, I'm just trying to think, when we first sort of were hearing about this, a lot of the sort of provincial committees were involved in, sort of giving input as to whether we felt it was a good idea. So it's probably been at least a couple of years, from inception. And we did hire one particular person, who is dedicated to sort of designing and then implementing the campaign through Cape National, and hopefully, to continue growing it.
Great. One of the things that, this ad shows you a clear example of somebody who feels the air pollution, right? They're choking on that wildfire smoke. And we all know that, was like, we had a day of action last year, that Canada's Burning Day of Action as part of 350 Nationals efforts to draw attention to that. And, you could feel it, right? You could feel your eyes and your throat and everything. But could you talk a little bit about how much maybe we don't appreciate when air pollution is present? One of the things certainly within Hamilton is that there was this long-standing idea that air pollution was really a problem for the lower city, that being in the lower city and close to industry, people could see, you get sort of the sooty stuff on your windowsill, and that the air that you're breathing has pollution. But one of the things that has been found through routine air quality monitoring is that, in fact, people far away are still experiencing impacts. People in the sort of suburban parts of the city are also having these deleterious effects from all of the pollution, even though they think that they're isolated from it. So can you maybe discuss, can you always tell that maybe it's a bad air quality day, or that, your gas is leaking in your house, or any of these other impacts? Can we sense it?
No, exactly. And that is important, to raise awareness. And it's one of the reasons that, that we talk a lot about indoor air pollution as well, because a lot of people, feel, well, the air pollution is an outdoor thing for starters. So of course, the whole notion of indoor air pollution is really important to discuss and educate on. But yeah, the idea, for instance, I mentioned the traffic related air pollution. So, no matter where you are, there's traffic, and to understand that, say, for instance, industry, if we look at the sectors that produce air pollution, of course, it's up there. But as I mentioned, say for Ontario, transportation is the largest contributor, followed by our buildings. Those things are often largely silent. And the other thing that I always like to talk about too is, that it's not just asthma, it's not just respiratory. That's just the portal of entry. So it's so important for people to realize that, when we're breathing this stuff in, the toxins are distributing throughout our bodies, and they are impacting, so many systems of our bodies. The research showing that on, certain, I think it's days with higher sulfur dioxide, they've done studies showing that there's more hospital admissions for heart attacks, arrhythmias and things like that. So there's such a direct correlation.
So I'm going to get through the rest of the couple questions I have left for you, and then we'll throw it to questions from folks in the chat or via raised hand. Something I just wanted to draw attention to, because you're the Ontario co-chair. I think most people have heard about the state of healthcare in Ontario, and many of us are also aware of, feeling like that whack-a-mole analogy was really good. Like just every couple weeks,
Yeah.
there's some new bill that comes out that is harmful to the environment, harmful to our cities, preventing sustainable action, preventing action around equity. Like, how do you see the link between, sort of the feeling that we have in the climate movement, like everything's on fire, and that this provincial government is moving us backwards? Do you feel that same feeling in healthcare? And do you think that healthcare providers are understanding that this is happening everywhere?
Right. And of course, I mean, yes, there's the whole idea of the impact of environment on healthcare, the demands, in terms of increasing disease burden, disruptions in supply chains, interference with, facilities management, all of these different kind of impacts. And then the idea of healthcare itself, what we're seeing in Ontario, the balance between private and publicly funded healthcare and all of that. So there's a whole complex set of issues. Many of them are interconnected. And yes, it does feel like whack-a-mole. I mean, it's just, and I think that it's so important to have a vision of something that, of how it could be different and how it could be so much better, even with the finite resources that we have, just by managing those resources better. That it's not always a matter, often, I mean, we often see this in the environmental sphere, right? That, well, we have to develop, carbon capture, or, it's got to be the SMR, this idea that, what we need, the solutions are, off in the horizon, and we just need that research and that innovation. But, it's a matter of using what we have at hand. The solutions are there, and we just need that will and that proper management of our resources.
And do you think that most healthcare providers understand the imminent risk that, climate change poses to all of us and to human health? Do you think that that's some way that groups like ours can be more effective in trying to reach out to people in different fields and maybe let them see the connections that are going to happen to their areas of passion and expertise?
Right. So what's happening in healthcare? So the simple answer is that the current state of affairs, I do not think that we have enough penetrance of planetary health knowledge and information, even within the healthcare sector. So we're doing a lot of work to try to improve the education within healthcare, within the healthcare sector. And that has already, certainly I'm more aware of what's happening, in medicine itself. And what's happening basically is that our younger practitioners are going to, come out much better apprised of what's going on, because medical school curricula have now formally integrated planetary health right across the country, and that's been great. And Canada's really ahead. In the US, this is being done jurisdiction by jurisdiction, so it's very piecemeal, and they're behind. In Canada, It's been done as one sort of cohesive action. And I have to say, so sometimes when I'm actually speaking to other physicians, I'll say there's so much we who are older can learn from the younger physicians and learners. So all of this, the med school education system being revised this way was actually done out of the Canadian Federation of Medical Students. They took the initiative and they got it done. But it is changing. Say for myself, I'm a specialist, so at the Royal College of Physicians and Surgeons, new planetary health is being integrated into sort of what we call our CAN-MEDS, our educational goals, objectives. So it's coming, but not fast enough. So.
Do you think that public health professionals are ahead? In Hamilton, one of the recent developments is that our Board of Public Health is going to undergo a restructuring to contain more community voices at the table. Do you see public health as being an important avenue for making changes in our cities that maybe, if you look at it just from a climate lens, they don't go anywhere, but if you bring in that public health, you can get further and change more hearts and minds?
Yes, absolutely. I think yes. I mean, speaking as a physician who's not actually, my area is not in public health, in terms of my background training. Yes, I would say our public health trained colleagues are far ahead. And also, not only in educating, but for instance, some of the work being done here in Ontario has to do, for instance, with metrics. So how do we measure the contribution of climate to death rates and mortality? So when it comes, when a coroner is investing a case or a death is being reported, we need to actually restructure the way that we're doing these things so that we have better metrics and we're better able to understand. So this will contribute even to our understanding, research, and so on as well.
Final question for me. You mentioned the mass mortality event in BC, right? The heat dome that caused over 600 deaths. My understanding is that in Ontario, we don't track heat deaths. Is that correct?
That's exactly what I mean in terms of some of the work that's being done. Yes, it's not being reported fully. So we need a revision of the criteria, reporting criteria, and so on. And that's exactly, some of the work that is ongoing. But yes, we don't have that yet. And in BC, they are ahead of us with reporting that.
And is that something that you would see groups like ours being really important to advocate for? Sort of the citizen climate groups, because we've mentioned many times ahead of our city council that people can and will pass away due to extreme heat now and in the future. And it's sort of like, oh, okay, but we don't actually have numbers to back it up. So definitely, I think that's something that's been on the minds of many of us as we try to get these measures through.
Yeah, no, absolutely. I think that the more people that are aware, and if that advocacy is coming from outside the health sector, it's so powerful. So absolutely.
Great. I've got a question from Dawn in the chat, but first I'm going to throw it to Jim and Steve who have their hands raised.
Thanks for your talk, Millie. That was really great. I had to chuckle when you referred to the fact that us older folks are learning from the young people as I watch you give this talk.
I've been in practice for about 30 years, so yeah.
Well, you look very young. Anyway, you've done a great job in the talk, and there wasn't much room for anything more, I guess. But I'm just wondering, most of what you've talked about are sort of acute effects of gas and air pollution. And back in the early 2000s, I was involved in studies that looked at the impacts of coal-fired, well, I guess coal-fired anything, but we focused on steel plants and mutation rates. And what we showed experimentally was breathable particulate from those stacks from coal-fired steel plants increases germline mutation rates. That is, primarily changes to sperm that is passed on to the young in the next generation. And this is a potential basis for objecting to coal-fired, but also I'm thinking about natural gas directly, and also the impacts of fracked gas and the pollution caused by natural gas in general, including forest fires. And I wonder if there has been recent research that looks at the more indirect effects through changes in DNA and through transmission to the young. Has there been? I actually, most of that research was sort of sidebar research for me, and I mostly study birds with very strange social systems, so I haven't kept up on the research and just wondered if there were some updates. I know it's not exactly your field, but have you heard of any of this work?
No, it's a fantastic question, and I'm just not up on, on the latest along those lines. I don't know if there's anybody else on the call who, who is aware. Because I mean, there's just such a wide breadth of work. It's hard to keep up with, with all of what's going on. But certainly, I mean, it is amazing how complex the pathways of some of these, even the acute impacts are. If we look at, rising antibiotic resistance, for instance, to look at how this is happening is, it's very complex. So, but it's a great question.
Steve, go ahead.
Hi, Molly. Thank you for joining us on this call. I know you have another one to go to very soon, so I'll try to keep it brief. It's a very powerful message in terms of the impact of the climate on healthcare that you are conveying, and great that that Kate, given the medical background, that you're able to have such a leverage and influence on a lot of our legislators and so on. But there was an alarming message that came out from the OCEA this morning. I saw talking about the fact that the IESO's 2024 annual planning outlook is talking about Ontario's electricity supply in 2030 will be going up to 25% from the 4% that it was in 2017. And the IESO is asking the federal government to increase its emission caps to 5 times what it was in 2017. What's your reaction to this? Like, this is the IESO's estimate, but it's based on something. Do you have any insight into those numbers?
No, like you, I read that briefly when it came across my desk today as well. I haven't had time to really sort of delve into it. And I was, certainly very, very disappointed to see the numbers. I don't have any sort of, inside information or intel on, on what this is based on. But, one of the things that certainly I've heard, and again, this is purely by hearsay when it comes to negotiating with the federal government and the CER and all of that, is that apparently it does seem that, some interest groups, organizations are sort of betting on, a team change at the federal level and hoping that, a lot of this work is going to be undone again and just kind of trying to hang tight till the next federal election. So, things like that are, I know that personally, that's something that I spend a lot of time thinking about is, how do we sort of proof the difficult gains that we make in climate and planetary health against regime change, so to speak. And that's one of the reasons that, I certainly feel that public education is so important, because probably one of the best ways to prevent sort of slippage of these kind of policy, progress that we make, are having people aware and educated enough, so that there'd be enough of a public outcry that, that progress isn't undone, quite as faster than we can create it. But it's very disappointing, and it's frustrating for sure.
We definitely share your frustration.
Yeah, I'm sure.
Worry not. But yeah.
Mhm.
Do you have time for one more question? There was one in the chat from Don McLean earlier.
I do.
He wants to talk about fracked gas. So we don't have exact numbers because Enbridge won't tell us, but we think it's north of 80% of the gas being sold in Ontario is from fracking, predominantly in Western Canada and in Pennsylvania and other US states. Do you want to speak briefly to the harms of fracking on health?
Again, I'm not very, very well versed in the fracking in particular. But simply the idea that, I mean, we've got increasing evidence that when we are when, you know, when we're doing these metrics in terms of, you know, what is the impact of gas, some of the recent shifts where, you know, we can now sort of pretty confidently say that gas is as harmful as coal. And that has, when it comes to health impacts, and LNG even more harmful than coal. And some of those metrics come from actually measuring the entire life cycle analysis. And of course, that life cycle has to take into account the source. So, you know, the fracking, as well as transmission and you know, leakage string transmission and all of that. So that's not a great or complete answer. My apologies for that. But certainly, you know, that's one of the things that, you know, where our understanding has really improved recently, and again, can really be utilized in our advocacy.
Well, and that's one thing, a discussion we're having in Hamilton that we're going to continue to have, is that we're being pitched over and over again that LNG is going to reduce the harms that are currently associated with coal use in our city. And, you know, the evidence is piling up that that's not entirely the case.
Exactly. Yes.
Yes. Thanks from all of us. Well, I don't know if we have any other questions. Anybody going once, going twice? No? All right. Well, thank you so much, Mili, for coming and speaking with us. Really appreciate it. It was a really informative discussion.
Thanks to all of you. And yeah, it was wonderful to be here. And thank you for all the work that you do. I mean, hearing hearing your talk last week, I mean, it's just wonderful. And we really thank you.